Hello everyone, I'm myself Dr. Rajesh Gubba. I'm the general medicine educator. So in this session, I'll be discussing a very important topic, that is the mesothelioma. So first of all, you should understand what exactly is this mesothelioma. Mesothelioma, it is a primary tumor which is arising from It is a primary tumor which is arising from the surface lining of the pleura or peritoneum. Okay, from the surface lining of the pleura or the peritoneum. So the primary tumor arising from the surface lining of the pleura, it is seen in 80% of cases, whereas from peritoneum it is 20% of cases. Now, what is the basic etiology, important etiology for the development of this mesothelioma? So, numerous studies have done and confirmed the association of malignant pleural mesothelioma with exposure of asbestos. Right, so the etiology is exposure to asbestos. Now, what is the lifetime risk to asbestos workers developing this malignant pleural mesothelioma? The lifetime risk of the asbestos workers developing this malignant pleural mesothelioma, it is as high as 10%. Right, it is as high as 10%. Now, what is the latent period? So, the latent period means between the exposure and the onset of the symptoms, it ranges from 20 to 40 years. So, the latent period is around 20 to 40 years between the exposure and the onset of the symptoms. Now, coming to the history of exposure. So, it is mainly the asbestos exposure is the one which will make the individual to develop what is called mesothelioma. Now, the question is, the asbestos exposure occurs in which particular group of individuals? Asbestos exposure, it occurs through mining. So, you should ask this particular history of whether the individual does he work in the mining industry, milling and manufacturing, shipyard work. Then next, insulation. Brake lining. And next, building construction. Right? And these are the various scenarios where the individual can get exposed to the asbestos. And even other asbestos products like pipes, textiles, paints, tiles, gaskets. So these are all the various asbestos containing products. Now, what will be the signs and symptoms in the patients with the mesothelioma? So the average interval between the onset of symptoms and diagnosis is 2 to 3 months. Okay, so the average time period from the onset of symptoms and diagnosis, it is around 2 to 3 months. And the median age at which you will diagnose this mesothelioma is around 72 to 74 years. What will be the symptoms in these patients with the mesothelioma? That is dyspnea. That is shortness of breath. And the individual can also have weight loss, because any malignancy, right, there will be increased metabolic activity of the cell where it will consume the energy causing the weight loss of the individual, and there will be non-pleuritic chest pain. See, in case of pleuritic chest pain, the pain increases on inspiration and it is a pointed pain, but whereas here it is non-pleuritic chest pain. And on examination, what is that you will be able to make out? On examination, in patients with mesothelioma, you will have dullness on percussion. Right? You have dullness on percussion. And if you take the breath sounds, they are reduced. So why do you think that the breath sounds are reduced? Because mesothelioma, it is a tumor from the pleura. So this thickened pleura or the abnormal pleura will not allow the adequate breath sounds to be transmitted to the surface of the chest wall. And the same thing is even percussion also. In the percussion, the normal note is the resonant note over the lung. But because of the pleural thickness, that resonance will get impaired. So there will be dull note. So there will be diminished breath sounds, and in some cases in the fingers you can also observe the presence of digital clubbing, right? So these are the clinical manifestations and as well as the examination points in patients with the mesothelioma. Then how will you diagnose these patients with the mesothelioma? See, that is by doing the pleural fluid analysis. So pleural fluid analysis has to be done. So these patients, they develop pleural effusion, and this particular pleural effusion, right, we have actually two types. One is transudative type of pleural effusion and the other one is exudative type of pleural effusion. So the pleural effusion in mesothelioma, what you will have is exudative type of pleural effusion, right, exudative type of pleural effusion, and it is often hemorrhagic. Right, it is often hemorrhagic. And if you do cytological tests of the pleural fluid, they are often negative. Now, apart from the pleural fluid analysis, you need to do the histological diagnosis as well. And for doing the histological diagnosis, you require an adequate specimen. Right? And how will you take out this adequate specimen? So, this particular adequate specimen is taken out by video assisted thoracoscopic biopsy. So by doing the wax biopsy is usually necessary to obtain an adequate specimen for histological diagnosis. Now this particular histological variants of malignant mesothelioma are of the following types. So if you take the histological variants, right, so if you see the histological variants of this malignant pleural mesothelioma, these histological variants include epithelial, right, and the histological variants include sarcomatoid, right, sarcomatoid, and biphasic. Biphasic in the sense both epithelioid and as well as the sarcomatoid. But out of all these, which particular histological variant is more common? That can be asked as a multiple choice question to you. So epithelial variant, it constitutes 50 to 60%, and that is the most common histological variant in case of mesothelioma. Now the next important point is, since the distinction from benign inflammatory condition and metastatic adenocarcinoma may be difficult, what you need to do is, to differentiate this, you need to do immunohistochemical stains. So what is the purpose of doing this immunohistochemical stains? That is, right, so this immunohistochemical stains, they help in differentiating benign inflammatory condition and metastatic adenocarcinoma. Right? They are important to confirm the diagnosis. So this will be the laboratory diagnosis. Then followed by that, the imaging studies. So radiological abnormalities, if you see, it consists of the nodularity. Right? Radiological abnormalities, if you see, that consists of nodular, right? You can make out here, right? Nodular, and it is irregular, right? Nodular, irregular, unilateral pleural thickening. Right, unilateral pleural thickening and varying degrees of unilateral pleural effusion. Right, there will be also varying degrees of unilateral pleural effusion. That is what you will see within the imaging studies. And almost in 60% of patients, they have right-sided disease. Right, in almost 60% of patients, they have right-sided disease. But only in 5% of individuals, the pleural effusion, it is bilateral, or only in, so in 60% of patients, it is the right-sided disease, while only 5% they have bilateral involvement, right? 60% right-sided mesothelioma, 5% bilateral mesothelioma. And this particular CT scan will also demonstrate the extent of the pleural involvement. That is another advantage of the CT. Right, this will also tell you what is the extent of the pleural involvement. Next, we have another important imaging, that is PET-CT. Right, that is PET-CT, that is positron emission tomography CT scan. It is used to help differentiate benign from malignant pleural disease. So, to differentiate benign from malignant pleural disease, you require this particular PET-CT scan. And not only that, the other important uses of this particular PET-CT is, it also helps in staging of the mesothelioma, and accordingly we can plan for the treatment as well. And we can also identify the candidates for aggressive surgical procedures. Right, so this is the purpose of the imaging. So CT scan, if you see, it shows you nodular, irregular, unilateral pleural thickening and varying degrees of unilateral pleural effusion. And in 60% of patients, they have right-sided disease, while only 5% that is bilateral involvement. And CT scan, it also helps in demonstrating what is the extent of the pleural involvement. And the other thing is the PET-CT. The purpose of this PET-CT is mainly to differentiate benign from malignant pleural disease. And it also helps in improving the accuracy, and it also helps in identifying the candidates for aggressive surgical procedures. Then, followed by that, what are the complications of the mesothelioma? See, mainly if you take malignant pleural mesothelioma, they progress rapidly as the tumor spreads along the pleural surface to involve the pericardium. So, if you take the malignant pleural mesothelioma, right, there is aggressive spread of the pleural mesothelioma, and it is being spread to the pericardium, right, that is to the heart. And not only to the pericardium, it also spreads to the mediastinum. And it also spreads to the contralateral pleura. Right? It also spreads to contralateral pleura. And this particular tumor may eventually extend beyond the thorax to involve the abdominal lymph nodes. Okay? So this malignant mesothelioma will spread beyond the thorax to involve the abdominal lymph nodes and organs. And what will be the clinical features of these particular complications? Progressive pain and dyspnea. These are very characteristic features. Now, apart from the aggressive spread to the various other organs, the mesothelioma, it also causes the local invasion of the thoracic structures. Now, what will be that particular local invasion? So, if you observe the local invasion, that it spreads to the superior vena cava, causing superior vena cava syndrome, SVC syndrome. And next, it can spread to the surrounding recurrent laryngeal nerve, causing the hoarseness of voice. And it can spread to the surrounding sympathetic chain, causing the Horner syndrome. Causing Horner syndrome. And by spread to the pericardium and as well as myocardium, the individual can develop arrhythmias. And this mesothelioma can cause even compression of the esophagus, causing dysphagia. So this will be the complications that you will come across in patients with the malignant pleural mesothelioma. They progress rapidly, to the surrounding pericardium, mediastinum, and as well as even contralateral pleura. And sometimes they spread even beyond the thorax to involve the abdominal lymph nodes and organs. And local invasion of thoracic structures may cause superior vena cava syndrome, hoarseness of voice, Horner syndrome, arrhythmias, and as well as the dysphagias. Now, coming to the treatment. See, what is the mainstay of treatment? The mainstay of treatment is the chemotherapy. And along with the chemotherapy, you need to do cytoreductive surgery. You need to do cytoreductive surgery. So cytoreductive surgery along with chemotherapy, this is what is included in multimodality treatment. Now, let me discuss about this chemotherapy and as well as the cytoreductive surgery. So, for localized disease, surgical options, what are they? They include pleurectomy and decortication. So, for localized disease, that is when the disease is just confined only to the pleura. For localized disease, you need to do pleurectomy. You need to do pleurectomy and decortication. Decortication. Now, what is this decortication? Decortication is surgical stripping of the pleura and pericardium from apex of the lung to the diaphragm. That is what is called as decortication. That is surgical stripping of pleura from apex of the lung to the diaphragm. So that is what is your decortication. So that is for localized disease, these are the surgical options. Or extrapleural pneumonectomy. That is another surgical option. Now, what is this extrapleural pneumonectomy? Extrapleural pneumonectomy, it is a radical surgical procedure involving removal of the ipsilateral lung, parietal and visceral pleura, pericardium, and most of the hemidiaphragm. That is what is your extrapleural pneumonectomy. Right, so what all structures you will take out in this extrapleural pneumonectomy? You will take out the ipsilateral lung. Why is this? That is because of the spread of the mesothelioma to the lung, right? Mainly the involved lung, and along with that, removal of parietal and parietal and as well as the visceral pleura, pericardium, and most of the hemidiaphragm. Right, so these are the structures which are being removed in case of the extrapleural pneumonectomy. Now, surgical cytoreduction alone is not sufficient. Chemotherapy or radiotherapy should be included in the multimodality approach. Right, so multimodality approach means you also need to include the chemotherapy as well. So chemotherapy, in which cases they are required? See, if the disease is localized, no problem, we can just do the pleurectomy and as well as the decortication or extrapleural pneumonectomy can be done. But the point is that in advanced unresectable diseases, what you will do? So in advanced in advanced unresectable diseases, palliative chemotherapy should be given, and that particular palliative chemotherapy include combination of cisplatin and pemetrexed. Right, combination of cisplatin and pemetrexed. This combination can achieve response rates up to 30 to 40%. Right, this combination can achieve the response rates up to 30 to 40%. And this combination will improve the survival up to 12 months. Right, will improve the survival up to 12 months. That is what is the importance of this combination, and this combination can improve even the quality of the life as well. Now, we have a monoclonal antibody, and that particular monoclonal antibody is bevacizumab. So, adding bevacizumab, which is a monoclonal antibody, to cisplatin and pemetrexed has shown to further improve the overall survival. So, you add this. So, this particular combination, what is this bevacizumab? It is a monoclonal antibody to vascular endothelial growth factor. So, this combination has found to improve the survival then compared to combination of only cisplatin and as well as the pemetrexed. Now, and apart from that, if there is presence of the pleural effusion, I said you like there can be unilateral pleural effusion. So, if there is pleural effusion, you need to do thoracocentesis. So, drainage of pleural effusion, radiation therapy, and even surgical resection, all these may offer palliative benefits to some patients. Then, after having discussed about the treatment, how will be the prognosis in this individual? Most of the patients, they die of respiratory failure. right? Most of the patients, they die of respiratory failure, and they may also die because of complications of the local extension. Right, because of complications of the local extension. And median survival time from diagnosis, it ranges from, so if you take the median survival time, it ranges from 7 months to 17 months, right? 7 months to 17 months. And 5-year survival, right? 5-year survival, it is almost 5 to 10%. Right? 5-year survival is almost like 5 to 10%. And these tumors are, or the tumors, I said you, like we have epithelioid, sarcomatoid and biphasic. Tumors that are predominantly sarcomatoid, they are more resistant to therapy. Okay, so please remember, this is a very important multiple choice question. Sarcomatoid tumors, they are resistant to therapy and they have poor prognosis. Right, they have poor prognosis. Median survival, right, median survival is less than 1 year in case of the sarcomatoid tumors. And what will be the poor prognostic features? The poor prognostic features in patients with mesothelioma, they include, number 1, poor performance status, non-epithelioid histology. That means like sarcomatoid tumors, they have poor prognosis. Next, male gender, lymph node involvement, right, that is nodal involvement, elevated lactate dehydrogenase levels, that is elevated LDH, and elevated WBC count, right, elevated WBC count. Then not only elevated WBC count, low hemoglobin and as well as high platelet count. Right, low hemoglobin and high platelet count. So these are the poor prognostic factors in a patient with the mesothelioma, right? So this completes the discussion of the mesothelioma. Let me just shortly recap the entire topic of mesothelioma in just few minutes. So mesothelioma, if you see, it's a primary tumor, right, which is originating from the pleura or peritoneum. Majority it is from pleura, and the very important etiology is the asbestos exposure. Latent period between exposure and onset of the symptoms is around 20 to 40 years. And asbestos exposure is seen in individuals with mining, milling, manufacturing, shipyard work, insulation, brake lining, building constructions. And signs and symptoms, if you see, mainly breathlessness, non-pleuritic chest pain and weight loss. Physical examination include percussion will be dull. There will be diminished breath sounds, and some cases there can be also digital clubbing. And laboratory diagnosis, if you see, exudative type of pleural effusion will be there. And in order to take an adequate specimen, you need to do a VATS biopsy. And histological variants are, right, like we have epithelioid, sarcomatoid and biphasic. Epithelioid is most common. Sarcomatoid is like having poor prognosis. And imaging. See, the CT scan, it shows the nodular, irregular, unilateral pleural thickening, and there can be varying degrees of unilateral pleural effusion also. And 60% of the disease, mostly it is right-sided, while only 5% it is bilateral. And CT scan, it also demonstrates the extent of the pleural involvement. And the PET CT is used to differentiate the malignant pleural disease from the benign conditions. And PET CT, it also helps in improving the staging accuracy. And it also identifies the candidates for aggressive surgical procedures. The complications of this mesothelioma, it includes malignant pleural mesothelioma. It has a very rapid spread, right? Rapid spread to the pericardium, rapid spread to the contralateral pleura, rapid spread even to the mediastinum, and even there can be extrathoracic spread to the abdominal lymph node and organs as well. And local invasion to the thoracic structures will cause superior vena cava syndrome, hoarseness of voice, Horner syndrome, arrhythmias, and even dysphagia. Treatment is like multimodality treatment. For localized disease, surgical options, they include like pleurectomy and decortication or extrapleural pneumonectomy, right? And if you see in case of advanced unresectable diseases, for them you need to give cisplatin and as well as pemetrexed. But if you add bevacizumab to this combination of cisplatin and pemetrexed, right, that further improve the overall survival of the individual. And if there is pleural effusion, you need to do drainage, right? You need to do drainage. And prognosis, if you see, most of the patients, they die of respiratory failure and complications of local extension. Median survival, it ranged from 7 months to 17 months. 5-year survival is only 5 to 10%. And the worst tumor is sarcomatoid tumor, where the median survival is less than 1 year. And poor prognostic factors are poor performance status of the individual, non-epithelioid histology, male gender, nodal involvement, elevated LDH, high WBC count, low hemoglobin, and high platelet count. So this is about the prognosis in patients with mesothelioma, right? So with this, I'm done with the topic of mesothelioma, and thank you very much.